Another marker we look at, ferritin. This is iron storage. And so this is a high inflammation marker. It's not just about iron. It's an acute phase reactant. And so too low shows immune dysfunction or fatigue, and too high, oxidative stress and inflammation. The next marker we look at is homocysteine. This is one of the most underrated inflammation markers. Optimal number, less than 8. Many labs are going to say up to 15 and call it normal. But high homocysteine is indicative of endothelial damage, so the linings of your blood vessels, neuroinflammation, and cardiovascular risk. Homocysteine tells me how inflamed your blood vessels are, not just your heart.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome back to another episode of Health Decoded. I'm your host, Dr. Alessi. If I told you the most dangerous thing happening in your body right now might be something you can't feel, can't see, and probably wasn't flagged on your standard blood test, would you believe me? Today we're talking about inflammation, but not the kind you notice when you twist your ankle or when you come down with the flu. I'm talking about the silent chronic inflammation that builds under the scenes without you even knowing. And this is the kind that slowly damages blood vessels, disrupts hormones, wrecks your gut, makes your brain foggy, and then quietly rewires your metabolism. All the while you're being told by your doctors that everything looks normal, your labs are normal. This is the inflammation that it doesn't scream, it's not present, it whispers, often for years, and then one day shows up as heart disease, autoimmunity, diabetes, dementia, chronic pain, or depression. And here's the truth. Most people don't hear it until it's too late. So it's important to know that inflammation is not the symptom, it's the environment. It's the soil that chronic disease grows in. And in this episode, here's what I'm going to break down for you. How inflammation hides in plain sight, why standard medicine often misses it, the real blood markers that actually tell the truth with inflammation, and then most importantly, what everyone cares about is how we reverse inflammation before it turns into disease. Because if you can lower inflammation, you're not just going to feel better, you will actually change the trajectory of your health. So let's get into it. Let's get into this first segment, what inflammation really is and why it's not the enemy. So let me clear something up right away, because inflammation gets thrown around as this blame for everything, right? Everyone says, oh, it's inflammation. Inflammation itself is not bad. However, chronic inflammation is. Acute inflammation is essential for survival. This is how you heal a cut. You fight off bacteria. Your immune system repairs damaged tissue. Without inflammation, you wouldn't make it through childhood. You would not survive. So the problem starts when the inflammation never shuts off. And that's exactly what our modern life has created. Your immune system evolved to handle short infection, physical injury, brief stress response. It did not evolve to handle 24/7 low-grade assault. And today, in the world we live in, inflammation is constantly being triggered by chronic psychological stress, endless emails and deadlines. Financial pressure is a big one. Ultra-processed foods that are hijacking your immune system. Poor sleep that prevents immune resolution. Environmental toxins and your liver can't keep up with. And constant blood sugar spikes that activate these immune inflammatory pathways. So instead of inflammation being a temporary repair response, it becomes a permanent state. There's a great quote from the journal 2020 review in Nature Reviews Immunology. It showed that chronic low-grade inflammation is a central driver of cardiovascular disease, Alzheimer's and cognitive decline, type 2 diabetes, autoimmune conditions, as well as depression and mood disorders. They all have chronic low-grade inflammation as a central factor. And this is why inflammation is now being referred to as inflammaging, the biological process that accelerates aging and disease. We call this cellular rusting. Picture your body almost like rusting from the inside out. And the truth is, you don't wake up one day with heart disease. You marinate in inflammation for decades first. Another truth that really shocks people is that inflammation doesn't just stay in one lane. If it starts in the gut, it spreads to the brain with the blood-brain barrier connected to the gut. If it starts in the fatty tissue, it impacts your hormones. If it starts in the immune system, it affects everything. And that's why treating inflammation isn't about pain meds. It's not about steroids or suppressing symptoms. It's about actually changing the environment that your immune system is reacting to. Because inflammation isn't trying to hurt you. It's actually trying to protect you from a world that's become chronically hostile to human biology. That's a great way to rewire the way we look at that. So let's proceed. Let's get into now, how does inflammation hide and why is standard medicine actually missing this? So here's where things start to fall apart in conventional healthcare, because most people assume that if inflammation is present, it will show up as pain or swelling or a fever. But chronic inflammation doesn't really play by those rules. It hides. It's simmering beneath the surface. It's quiet, low grade, and systemic. So it's damaging tissues slowly enough that your body adapts until it actually can't anymore. And that's when disease sets in. This is why I see this all the time. Patients come into our clinic saying, I'm exhausted. I feel horrible, but my labs are normal. My doctor told me everything was normal. Or I can't lose weight no matter what I do. My brain feels foggy. I'm achy everywhere, but nothing's technically wrong. They don't have any injuries. And unfortunately, and again, we hear this all the time, and it's really frustrating. They're often told, oh, this is just aging. You're just getting older, or that's normal. It's just stress. These are all gaslight phrases to basically tell someone we don't actually know and we have no answers for you. And so, a big thing to remember is that normal labs or normal blood work doesn't mean healthy. It just means common. And if we look at the world around us, the common and the normal is actually pretty unhealthy. And so why standard medicine really misses inflammation is because most primary care doctors are trained to look for acute disease, not early dysfunction. They are taught to ask, are you sick enough for a diagnosis? Are you inflamed enough to prescribe a drug? Are you broken enough for us to intervene? But chronic inflammation doesn't trip those alarms. Here's why it slips through, because they are missing the mark. They're only relying on outdated markers. They're using just a regular CRP, C-reactive protein, instead of a high sensitivity CRP, HS-CRP. They look at just your cholesterol overall, the total, instead of looking for things like oxidized LDL markers. They look at glucose instead of fasting insulin, or they run just a CBC instead of looking at immune patterns. And they're going to look at one marker at a time. They're going to isolate organs, one organ at a time. You go from specialist to specialist to specialist. Nobody's on the same page. And so there's no pattern recognition. And then the biggest thing we see is that Western medicine is trained to wait for pathology. So they're going to wait for autoimmune disease to kick in before they start to balance your immune system. They're going to wait for you to develop diabetes before they look into insulin resistance. They're going to wait for you to have heart disease before they screen for endothelial inflammation. And by the time conventional labs flag disease, inflammation has already been active for years, sometimes decades. A study out of The Lancet in 2018, this is a major journal, it identified chronic inflammation as a shared underlying mechanism across cardiovascular disease, cancer, diabetes, neurodegenerative disorders, and autoimmune disease, often preceding the diagnosis by, hear this, 10 to 20 years, meaning that those things were building up your entire life. And so what inflammation looks like before disease, okay, this is the stage that most people are stuck in, most people that we see. They're not quite sick enough for a diagnosis, but not well enough to feel like everything's okay, like themselves. And so take note of this. Here's early inflammatory warning signs, okay? Persistent fatigue despite getting adequate sleep, brain fog or mood instability, joint stiffness without injury, weight gain that does not respond to diet, gut symptoms that come and go, poor recovery from workouts, frequent colds or slow healing. Inflammation doesn't ask for permission. It just keeps collecting interest. And the part that frustrates people the most, as well as myself, is that you can have inflammation destroying your health and then everyone telling you you're normal. And that drives me crazy because the ranges that they're basing this off of were not built for optimal health. They're basically built to catch disease and keep people in a box. And so why this matters so much is because chronic inflammation over time is going to block signaling in the body. It will suppress your thyroid and disrupt cortisol rhythms, damage blood vessels, trigger autoimmunity, and all of that to accelerate the aging process. So suppressing inflammation without fixing the cause is like turning off the smoke alarm while the house is still on fire. Inflammation is not the enemy. It's the evidence. And the question is, what is your body reacting to? And so in the next segment, let's really get into, I want to show you the exact blood markers that we use to detect this hidden early inflammation. I also want to talk about what patterns matter more than individual numbers and how we catch inflammation before it becomes a diagnosis. Because once you can see inflammation clearly, you can finally do something about it and get ahead of the process. So now let's get into it. The blood markers that actually reveal hidden inflammation. All right, this is where we stop guessing and we start seeing, because inflammation isn't invisible. It's just being ignored or missed. And so you can't detect chronic inflammation with a standard annual physical panel. And that's not an opinion. That's just, unfortunately, the limitation of the system. So instead of asking, are you sick enough yet? We ask, what story are your labs already telling? And why patterns matter more than single numbers. So one of the biggest mistakes in conventional medicine is looking at labs in isolation, because inflammation doesn't show up as just one screaming marker. It shows up as a pattern drifting out of alignment. Disease doesn't start with one bad lab. It starts with 10 almost normal ones. And so here's some of the key blood markers that we use to uncover hidden chronic inflammation, often years before diagnosis. The number of patients we've helped to get ahead of diabetes and insulin resistance before they go full blown. And so number one, HSCRP. This is high sensitivity C-reactive protein. This is the bare minimum inflammation marker, and even this gets overlooked. Standard medicine says that under 3 is normal, but in functional medicine, I want to see under 1, ideally closer to 0.5. And there was a study out of the journal Circulation in 2019 said HSCRP is a stronger predictor of cardiovascular events than LDL cholesterol. Meanwhile, conventional medicine is so focused on lowering cholesterol, they don't even look at inflammation. And so you can have normal cholesterol and still be inflamed enough to build plaque. That's definitely a fact. The next factor we look at, or marker we look at, is fasting insulin, not just glucose. So most doctors are only going to check glucose or your A1C, but insulin resistance is an inflammatory by nature. And so optimal fasting insulin, 2 to 6 per milliliter, whereas most patients we see are often 10, 15, even 20 while being told they're fine by their doctor. And so a study out of the Journal of American College of Cardiology in 2021 said that hyperinsulinemia precedes diabetes and drives systemic inflammation. We use a specific marker as well alongside fasting insulin called the HOMA-IR marker. And this is a algorithmic score predictor of someone's trend towards insulin resistance and type 2 diabetes. And so we often see that this marker is elevated and other markers are normal. And so on a standard blood test, that would have been missed and the person could have been prevented from going full-blown type 2 diabetic. Because you don't get diabetes from just sugar, you get it from years of inflammation disrupting your insulin signaling alongside that high sugar. Another marker we look at, ferritin. This is iron storage. And so this is a high inflammation marker. It's not just about iron, it's an acute phase reactant. And so too low shows immune dysfunction or fatigue, and too high, oxidative stress and inflammation. So the optimal ranges you want to see in men between around 50 to 100 and women between around 30 to 80. And so a great resource, the Free Radical Biology and Medicine Journal. In 2018, they said elevated ferritin is associated with oxidative damage and metabolic disease. And so this plays right in with the function of the liver, pancreas, the gut, and obviously that insulin response in the body. The next marker we look at is homocysteine. This is one of the most underrated inflammation markers. Optimal number, less than 8. Many labs are going to say up to 15 and call it normal. But high homocysteine is indicative of endothelial damage, so the linings of your blood vessels, neuroinflammation, and cardiovascular risk. Homocysteine tells me how inflamed your blood vessels are, not just your heart. The next thing we look at is white blood cell patterns, not just the total. So most docs just glance at the total white blood cells and move on. We look at what is the neutrophil to lymphocyte ratio, chronic immune activation patterns, stress-driven immune suppression. These patterns indicate chronic infections or autoimmune priming. And so if these things are becoming dysregulated, we're able to predict earlier than wait till someone gets sick. Because again, your immune system is whispering in patterns long before it's screaming a diagnosis. Next, we're going to look at liver enzymes, ALT, AST, GGT. Your liver is your primary inflammation filter. Even high normal liver enzymes often indicate toxic burden, fatty liver, or oxidative stress. In the journal Hepatology in 2020, they said that elevated GGT strongly correlates with systemic inflammation and cardiovascular risk. So now putting this whole pattern together, right? Because one marker alone doesn't diagnose inflammation. But when we see HSCRP creeping up, insulin elevated, ferritin is drifting high, borderline homocysteine and immune ratios are off with high liver enzymes, it's not random. It's a global picture of inflammation building chronically under the scenes. And so your labs don't lie, but they do whisper. Functional medicine teaches you how to listen. And so every patient we take through our total care program, we not only run your labs, show your labs, we teach you how to read your labs. So that way you can make educated decisions as to how your health should be. You can run your own labs in the future and say, oh, these are starting to get high. I need to start to control this inflammation. And this is exactly why our program exists. Not to run more labs, but to catch the dysfunction early, identify the root drivers. Is it gut, stress, toxins? Track these trends over time and intervene before inflammation becomes disease. Because again, functional medicine, we don't wait for a diagnosis. We interrupt the process before it gets there. And so now I want to proceed into this final segment of the episode where I want to show you exactly how we reverse inflammation, what works and what's just suppressing it, and why lifestyle alone often isn't enough. Because seeing inflammation is step one, fixing it is where real medicine begins. Hey, Health Decoded listeners, Dr. Alessi here. Let me ask you a serious question. Are you tired of waiting until something goes wrong to finally see a doctor? At Alessi Functional Health, we take a different approach, the right approach. We believe true healthcare isn't about chasing symptoms. It's about preventing them in the first place. That's why we created the Alessi Total Care Program. This is a functional medicine-based membership that gives you proactive, personalized care year-round. You'll get access to comprehensive blood work and functional testing, custom doctor-grade nutraceuticals, deep discounts on labs, protocols, and follow-ups, as well as 24/7 direct access to your doctor, not just a 10-minute checkup that ends with another prescription. And here's the best part. As a Health Decoded listener, you'll get your first 3 months completely free when you sign up for an annual membership. That's on top of hundreds in savings already built into the program. This is your chance to take responsibility for your health and join a movement that's redefining what primary care should look like. Head on over to alessifunctionalhealth.com, click on our services tab, and go to Total Care. Learn more about this program and claim your exclusive podcast listener offer. Your health is your greatest asset. Let's protect it proactively. Okay, let's talk about now how we actually turn off inflammation. All right, now for the most important part of this entire conversation, because once you see inflammation coming, the real question is, what are you going to do about it? And here's where most people get stuck. They're told, just take some anti-inflammatory medication or a painkiller, take a statin or an antidepressant. But let me be very clear here. Suppressing inflammation is not the same as resolving it. Remember the fire alarm analogy. Inflammation is not the enemy. It's a signal that something's wrong. And if you don't remove what's causing the signal, your body will keep firing it. And so at Alessi Functional Health, we don't ask what drug turns this marker down. We ask, why is your immune system inflamed in the first place? And almost every time inflammation comes from one or more of 5 root drivers. So let's get into that. Blood sugar and insulin dysregulation. This is the biggest one. Chronic blood sugar spikes lead to chronic inflammation. Even healthy foods can be inflammatory if you eat too often, you undereat protein, you snack all day, or you live on caffeine. And so what does the fix look like? What we call protein-forward meals, prioritizing 30 grams of protein per meal, more if you're a larger male. Blood sugar stabilizing nutrition. This is complex carbohydrates, not just these fast metabolizing sugars. So avoiding white breads, processed grains, processed sugars, things like that. Sticking more towards starchy foods like potatoes, yams, cooked white rice. And then strategic fasting when appropriate. So intermittent fasting or alternate day fasting or every other day. Those are fantastic ways to balance blood sugar. Journal Cell Metabolism in 2020 quoted that insulin resistance is a primary upstream driver of systemic inflammation. This is just known now. And so you can't anti-inflammatory supplement your way out of bad blood sugar control. You have to get to the root cause, which is often lifestyle and diet. The next part, number 2, gut inflammation. So leaky gut or dysbiosis. If your gut is inflamed, your whole body will be inflamed. Why? Well, because 70 to 80% of your immune system lives there. Endotoxins can leak into the bloodstream through a leaky gut, and then your immune system remains on high alert, which can trigger autoimmunity. And so what does the fix look like for this? Removing inflammatory foods, what we call the big 5, dairy, gluten, processed sugar, soy, and seed oils. Repairing the gut lining using specific things like zinc carnosine, glutamine, aloe, marshmallow, these herbs that are able to restore health and mucin layer to the gut. Rebalancing the microbiome with correct probiotic use, not just some broad spectrum probiotic. You have to know which specific markers you need to elevate and some that you need to clear out. Clearing out hidden infections or overgrowth as well. And so in the journal Frontiers of Immunology 2021, it showed that intestinal permeability or leaky gut is a major driver of systemic inflammation and autoimmunity. This was my story. I had leaky gut syndrome that led to an autoimmune thyroid condition. I had to backtrack and go all the way to the root cause of healing my gut before I could even try to fix my thyroid. And to this day, my thyroid markers stay within range because of that fix. And so that's actually a program that I basically created for our patients based on what I did for myself. And I fine-tuned this 6-month program. If you're interested, go to alessifunctionalhealth.com/gut to learn more. The third thing, chronic stress and nervous system dysregulation. So this one gets ignored, but it's massive because if your nervous system is stuck in fight or flight, cortisol will remain elevated, inflammation will be high, and your body cannot heal. It shuts down. And so what does the fix look like? Nervous system regulation, making sure your vagus nerve is healthy, humming, deep breath work, sleep restoration. So going to sleep at the same time and waking up at the same time, getting deep sleep, dark room, no blue light before bed. Breath work, HRV training, and recovery focus. So utilizing hacks like red light, using things like breath work. And then structural correction, making sure that your nervous system is able to communicate. So things like chiropractic care, spinal decompression to take pressure off of the nerves. What we see all the time with our chiropractic patients is that they can't sleep or they're getting non-restful sleep because they're in pain. Basically, the nervous system is unable to relax because there's pressure on it. And so once we decompress the spine or take pressure off their spine with chiropractic care or decompression, they come back the next day. They're like, I had the best sleep of my life. And it's because we were able to let that nervous system relax. Because you cannot heal in survival mode, no matter how clean your diet is. The fourth one, toxic load. Okay, this is very important and often where we start with patients is some level of detoxification from plastics, mold, heavy metals, and chemicals. because your liver can only handle so much. And when detox pathways back up, inflammation will skyrocket. Basically, the liver backs up into the gut backs up, and then the body cannot handle that. And so what the fix looks like, number one, identifying the exposures. Is it heavy metals? Is it mold? Is it plastics? Is it environmental toxicity? And then supporting the liver and the lymphatic system. So we use specific things like binders and detoxification protocols, along with like our high frequency vibration platform and red light therapy to really push the body into detoxification. Sauna, sweating, movement, these are all fantastic as well. The journal Environmental Health Perspectives in 2019 has a quote saying chronic low-dose toxin exposure drives immune activation and inflammatory disease. So be aware of what things we're putting in and on our body. Lotions, perfumes, plastic in our clothing, those things can all build up. And then the fifth thing we're always going to assess is nutrient deficiencies. So inflammation is going to skyrocket when the body lacks the raw materials to regulate the immune response. The most common deficiencies we see are things like magnesium, omega-3s, zinc, vitamin D, and B vitamins. And so the fix looks like using specific doctor-grade nutraceuticals in the correct dose to replace and restore these levels. Now, this is all going to depend on the person, their genetics, their biology, and then obviously the labs that we run. And so we use a really awesome lab called the NutriPro Genetic Panel to tell how someone's genes influence the way that their body prioritizes the absorption and the utilization of nutrients and minerals. It's pretty awesome. And so the biggest, takeaway from this is lifestyle alone isn't always enough. It's important, but it's the foundation. For many people, it's not the full solution. So if someone has years of inflammation, autoimmune activation, deep insulin resistance, or toxic buildup, they often need advanced testing, targeted protocols, and then ongoing monitoring and maintenance. However, there are answers and there are fixes. You just need to do it in the right order. And so you didn't get inflamed overnight, and you won't heal overnight either, but you can heal. And so this is exactly why we built our total care program the way we did. I'll be upfront and honest about it. It is not a quick fix. So if that's what people want or are looking for, this isn't likely for you. And it's not a one size fits all either. It requires some specific testing to see where your deficiencies are. But with a deep lab analysis and pattern recognition focused with some root cause protocols, including lifestyle, nutraceuticals, and physical medicine integration, we don't just manage inflammation, we dismantle it layer by layer. So let me leave you with this, and then I'll stop talking. Inflammation doesn't mean that you're broken. It just means that your body is asking for help. Chronic disease is not just bad luck, it's unaddressed inflammation. And if left unchecked for too long, it can develop into more, like chronic disease. So if you are interested in learning more about any of our cutting-edge functional health programs for gut, liver detoxification, heavy metals, those kind of things, visit alessifunctionalhealth.com, and you can book an introductory appointment over the phone or come into the office. Be sure you include that you heard on the podcast about us, and you'll get an exclusive discount and a free gift. As always, I want to ask you, if you found value in today's show, please like and subscribe, and then share this with anyone who needs to hear it. That's how we get the message out, and we can change more lives and help people stop living with chronic disease. If you want to get in touch with us or be featured on an episode, you can email us your questions to ask@alessifxhealth.com. Oftentimes we will get questions and we will answer those and then post them on the show. You can also visit alessifunctionalhealth.com and sign up for our newsletter. This is how you're going to get access to our resources and learn about our approach to nutrition and cutting-edge therapies. I want to thank you again for tuning in to Health Decoded. I'm Dr. Alessi, and I will see you on the next one.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.